Amid the rising brain drain in Nigeria's health sector, the Lagos state government says it intends to reverse the trend to brain gains. The Lagos State Commissioner for Health, Professor Akin Abayomi, says the state wants to attract doctors in the diaspora to return and invest all forms of resources in the healthcare system in the country. Professor Abayomi made this known when he hosted the Lagos chapter of the Nigerian Medical Association, who paid a courtesy visit to the ministry. Reacting to this, chairman of the association, Dr. Benjamin Olowojebutu, in an exclusive interview with News Central, gave further detail on how the state government intends to attract human and financial investment to achieve better results in the state health sector.
In this country, you make it easy for them to be able to get people to come in. So for us, it's about bringing them in when the environment is very conducive for them. Making the environment, making business climate very good, improving the access to financing, access to the numbers, the data, and obviously data is what we're going to use to attract them. And because they're going to be specialized treatments and specialized things that people go abroad to do, for that has increased medical tourism. When you make the environment very, very available for us in Nigeria, they are able to come. I tell you the truth, as mentioned by the professor and by the commissioner, no Nigerian wants to live all their life abroad. They want to come back home.
How do we move from brain drain to brain gain? That is what we'll be discussing with Dr. Yinka Owolabi, former president, Association of Resident Doctors at the Ladoke Akintola University of Technology Teaching Hospital, Osogbo. Thank you very much, Doctor, for giving us your time. You've heard what the Lagos state government is saying. They're planning to reverse the trend in the health sector. How do you think this can be achieved?
Thank you very much. The professor is someone I respect a lot, and I believe he's trying his best as far as healthcare system delivery in Lagos State is concerned. But I'm a realist, and I think that what he's talking about it's quite difficult. Bringing people from diaspora to Nigeria to commit resources to work, I think it's a tall order, if you ask me, because if I understand where they are coming from, basically what they are looking at is probably a public-private partnership. And you will agree with me that when it comes to PPP, it's all about profit making. And I think I can challenge anyone to tell me if there is one person somewhere who will be bringing in business without looking at the profit aspect of things. And when we are talking about profit-making enterprise, then you want to ask the question, who are they serving? Is it the populace or is it for the elites? If you bring in PPP, definitely it is not for the populace, and that is where the concentration needs to be. So I think it sounds good, in the ears, but I really do not think that is what we need at this time. What we need, if you ask me, is actually, it lies with the governments. I think governments and our leaders, they have a bigger role to play here. When I say government, I'm not talking about Aso Rock. I'm not talking about the governor in the State House. I'm talking about system where we have people with oversight function. Okay, it can be the commissioner, it can be directors, name it. So I would say that unless governments or our leaders start to bring in sincerity, unless they start to bring in seriousness into the business of governance, and unless they appear to be selfless in the way they handle governance, then people will always have trust issues. And that is one of the reasons why we keep seeing doctors trooping out of the country. It's not just the health sector, but of course we are discussing health sector today.
Yes, let me quickly interject and take your mind back a few months ago. It was widely reported that a bill seeking to curb brain drain, mandating Nigerian medical doctors to practice for at least 5 years in the country before going abroad as one approach to help with the situation. Do you think this was a good call in the efforts to attract back diasporan doctors?
If I can recollect very well, I think that was from Honorable Ganiyu Johnson, and that was met with condemnations all over. For me, I think that we pass for the joke of the century, if you ask me. I'm sorry for using that. It can only come from an angle of ignorance, and I think it's nothing to discuss, really. It was definitely off, outlandish, to say the least. Our government, our leaders, they need to do more. You cannot be asking people to make sacrifices when they are not seeing the same in you. And I think that is where the problem is coming from. Yes, we've got a lot of challenges that we can try to address, but if the people do not see that commitment, that political will, even when you are making efforts, it will be difficult to bring them, on board. And that is what we are seeing. Yeah, so I think that was rather unfortunate from the Honorable. Again, these are people that are collecting millions to get SUVs and all the likes. So it's rather unfortunate. I think we can do better, really.
All right, you believe there are better ways to get Nigerian doctors back in the country, and that's to improve on the entire situation. Thank you very much for speaking with us.
Thank you very much. Thank you for having me.